So I'd first like to start by acknowledging the traditional custodians of these lands. And I also want to pay my respects to the custodians of the lands where I live in, and that's in Geelong, the land of the Wadawurrung people. And the word I'm using here is custodian, because that's what each of us are on this planet. We don't have the concept of ownership. First Nations peoples did not understand what ownership meant. Was all the way they lived was in relationship, in reciprocity, and that's what custodianship means. That's the message I want to start off with today. Now, the reason I have said from Japan to Goa is because what I'm going to talk about is forest therapy. And the word forest therapy derives from a concept that was started in Japan in the 1980s called Shinrin-Yoku. Shall we all say that together? Shinrin-Yoku. And that means forest bathing. Now, it does not mean that we put on a swimsuit and find a pond or a stream or a river in the forest and go swimming. But when we say immersing ourselves in nature, that means we slow down and we connect to nature through all of our senses. So, to give you an example of what that means, I'm going to pass around these lovely leaves from Tanya's garden. There's lemon leaves, so take one, just take one for yourself from each. So there's a curry leaf and a lemon leaf, and just crush it and smell it. And one of the really good ways of doing this is when you smell it. So really crush it, close your eyes and take a deep breath. I'll keep talking while we are doing this, but I want you to get an understanding of what immersing in nature means and immersing through your senses. While this is going on, the Japanese started this practice in the 1980s in response to massive stress in their societies. If you're my age, you will know that everything we had in those days was made in Japan. But that came at a cost. And there was massive stress in society to the extent that the Japanese had a word for death from stress, karoshi. And what was their response? Let's go back to nature. And that's when the CEOs and the managers went out into nature, got into a bus on a Friday, and they spent the weekend in a forest. And today, Japan has 62 forest therapy centers. 62. I would like to see this place also being considered a forest therapy center. Would not that be wonderful? Does it work now?
Yes.
All right. So, as this slide says here, our forests are not just ecological treasures. They are health infrastructure, economic engines, and community building spaces. But right now, they are under threat. If you have followed the news in Australia and what's happening with the bushfires, if you have followed any of the news about the devastation of forest and nature around the world, you will know that we are at a critical juncture. Going back to my story, I had no idea about this concept of Shinrin-Yoku, forest therapy, and that it started in Japan. But one day, as I was walking through the forest, I just happened to look up, and there was this one leaf, just this one leaf, that was caught by the sun. And as I looked up, I could just see every leaf, every detail of that leaf. And something, it moved me. It moved me to my core. And I was trying to find a word for what I was feeling. And I went online, I Googled it. I said, what is this? There must be a word. And that's how I found out about Shinrin-Yoku forest therapy. Just this one leaf, it was as if nature was saying, I need you to do something, Susan. And this is when I realized what forest therapy is, that the forest is the therapist. I am a forest therapy guide. I'm the president of the international organization. But I'm nothing when it comes to the therapeutic benefits of the forest. I'm just the guide. The forest is the therapist. And that's me. I traveled to Japan and to South Korea because I wanted to learn was this some kind of woo-woo practice of, hugging trees? I went to Japan, I went to Korea, and just to talk to the researchers, and I found that they had been doing like 35 years of research, going back to that time when they took stressed executives into the forest. What was this doing for them? And they found out there was huge physical and mental health benefits when we slow down in a forest. And I convinced a few people around me, including my husband, who's the scientist and the brain in the family, and he was convinced, and he's German, very difficult to convince them. And he was convinced to the extent that he said, okay, let's start this organization. I'll take care of the research, and now we need to train forest therapy guides. But still, why was I called to do this? Like I said, the forest is medicine. And I found out by doing my research for this presentation that even in Goa, the mangroves are under threat. Nature is under threat because of development. So what do we do to protect our forests? Because, like the young gentleman said before, our lifestyles, our stressful lifestyles are causing us lifestyle diseases, diseases that can be prevented. And if we consider the forest as a therapist, if you look at the forest as medicine, as preventative medicine, what do we need to do? So here's the global context. Climate instability is rising. We all know about climate change. I don't need to tell you that. But this is where it begins to make an impact on every one of us today, because we are all part of community. Communities are facing the impacts physically, emotionally, and economically. That is a picture of Beijing. And I'm sure it's no different to a lot of cities in India today. Climate change and health, you can't separate the two. Climate change affects planetary health, it affects human health. And there's nobody that can do anything other than us taking action at an individual level and at a community level. I'll share these slides because there's a lot of numbers and I'm aware of the time, so I'll just go through. But every day, if you go online, if you look at the air quality in New Delhi or Mumbai, we are at critical levels, we are at dangerous levels. And for me, I can't say this enough. It is our human right to have fresh air. It is our human right to have access to water. It is our human right to clean food. But what are we doing? Can we just say, we wait for the politicians to make those decisions for us? No. We need to stand up and speak up. What if you get up in the morning and you can't breathe? That's it, right? And this is where forests and this is where clean air becomes so important. And it has an effect on our on the cost of public health. Because instead of taking care of ourselves, we all run to the doctor, to the next hospital, to the next drug. And everyone's very happy to write the bill, and you go to the pharmacy. But doctors are leaving the profession. Counselors, psychologists, they cannot manage sorry, somebody said something. We cannot handle the stress, the pressure, the numbers of people who are knocking on our doors, who are calling the ambulance. What does that mean? It just means we need to take care of our health. So this was the message I was getting from that leaf. Health infrastructure. So this is where forest therapy comes in. I mentioned that in Japan we have forest therapy trails, we have forest therapy centers. And this is my mission. This is my mission for 2026. A lot of my work was focused for the last 7 years in the global north. And I turned and I said, I'm born in Sri Lanka. This is where we need it the most. Climate change I'm sorry if I offend anyone here, most of the climate change is because of industrialization in the global north. But who is affected the most? Us living in the global south. The poor people who have to live on the streets, work in dirty environments, don't have access to clean food, clean water, air conditioning. They are the ones who are bearing the brunt of it all, right? So I feel like I'm talking, I'm a bit political today, but when you drive around, even in India, like I'm like saying we can do better than this. If you go back thousands of years, we lived in harmony with nature. We were custodians, right? And we can get back to that. We have to take back up the power to decide how we live our lives, right? So forest therapy centers are really important, that we have places which are managed and built by communities and maintained, because this is the way we take care of our health, we take control of our health and our forests. And we found that it is a low cost, high impact, but evidence based therapy. And it has all these benefits. But more than anything, imagine if every community has access to a healing forest, like what they're trying to build here, just as they have access to a clinic or a park. Like I said, it is a human right for us to have access to a green space. Now, what is the definition of forest therapy? This is the definition that we came up as an organization. It's an evidence-based public health practice of guided forest therapy walks. And this is the difference. The guided forest, the guide. We train forest therapy guides around the world, and I want this as a profession for more countries in the global south, because that makes a difference. Because the guided forest therapy walks combine a specific blend of complementary physical and mental health exercises in suitable forest surroundings, leading to a lower heartbeat, blood pressure, and stress, while at the same time the immune system, breathing, and the overall physical and mental fitness and well-being are strengthened. So we need forest therapy centers, and we need guides. And it does not have to cost the earth. We are not building buildings, we are protecting the forest, and we are enabling communities to make use of this. And it's, like I said, it is not a woo-woo practice of tree hugging. All of these disciplines inform our work as forest therapy guides, from forestry to physiology to psychology to public health and to politics. We need to engage with our politicians. And here is the first level of politicians, community leaders. That's where it happens. You need to do that. It has come to that time when we need to be really loud and vocal in what we say and what our message is and what we want. We elected you to do this, not that. Am I making sense so far? Okay. But that's also an economic value. It's now ecotourism, well-being tourism is a $1 trillion industry. $1 trillion industry. It's not going to a fancy eco center. People want to get off a plane and have a relaxing holiday in nature. Gone are those days when people wanted this high impact, going out, dancing, shopping. People are realizing that we're all under a lot of stress. And when we want to take a break, we will spend more money. Actually, people who understand the benefits of a quiet holiday in nature, they will spend more money to get that experience. And here, look at this beautiful forest we have, the trees, the plants, the birds. We just need to make it happen. I think we recognize someone in that picture. No? So Peter came and joined us a couple of years ago in Dwelling Up, and he came on our forest therapy retreat because he wanted to know what is this forest therapy all about. Because that's jobs creation in this industry. Whether you call it nature therapy or forest therapy, guiding is becoming quite a sought after profession. And I have taken a personal interest in training people in the global south. So whether whether you're a tourism operator, a guide, ecologist, we can train you to take people on forest therapy walks. Don't we all look happy there? How often do you get a corporate group of people looking this happy? And this is another forest type that is being developed and has been developed for the last 20 years. It's called an analog forest. And the man who started this is now on our advisory board. You can read about more, you can talk to me what that means, but it's all based in nature, supported and built by local people. The Peco Trail, it's a world famous trail now going through the tea estates in Sri Lanka. And young women, their parents were probably tea pluckers, and now they are being trained to be trail guides. Women empowerment, yes. Forest therapy centers are spreading throughout. I just came back from Vietnam, and the first guide that I trained there, her father bought a piece of land 40 years ago, and today it's a forest therapy center. In China, in Taiwan, it is now a thing. And we need to see that more in Sri Lanka, in Bangladesh, in India, in Goa, right? We have a forest therapy trail on a campus in Australia. And why? What is the community there? For international students, they're very stressed. They come from India, from Sri Lanka, to a new country. They're challenged with studies, with finding job, for keeping their parents happy. Are you getting A grades? They're very stressed. So we built a forest therapy center right on campus, and we have got government funding to do studies to see the impact of taking young people out on guided forest therapy sessions. And I'll share with you, if you want to, the latest report and the findings. It's as simple as a walk in nature. No phones. We tell the young people, when you come to our walk, you switch from screen time to green time. They love it. Digital detoxing, it's a very important aspect of our lives today. And we see forest therapy as community connection. Connection is restored, loneliness decreases, belonging increases, and communities become more resilient. We take people on 2-hour forest therapy sessions. We don't walk more than a kilometer. Now imagine walking 2 hours. So what are we doing? We're just helping people to slow down. We stop. We ask people to share. And in that sharing is such a beautiful experience for everyone. It's something we don't do enough. We're on our phones, we look at our phones, we get all our information. We don't know how to communicate with each other. I always say we are human beings, not human doings. And we need to know how to just be in nature. And that's where the guide comes in and plays that really important role. It's also about environmental stewardship. There's this wonderful quote, you will only protect what you love. How do we make people fall in love with nature? By taking them to nature, to touch leaves, to listen to the sound of the wind, the birds, to just be, to take a deep breath. Let's take a deep breath in. That's all we do. We just do that. Simple things, but we have forgotten how to be in relationship with nature. And that's where the magic happens. And that's why I think I will do this work till my dying day. Because nothing gives me more satisfaction than to see happy faces at the end of a 2-hour session. We do forest therapy sessions every Sunday at the Royal Botanic Gardens, Melbourne. 20 people is the maximum number. We sell out every week, every Sunday, $50 for 2 hours. And nobody ever bats an eyelid about that. People keep coming back. They celebrate, they do corporate events with us, they celebrate birthdays with us, because people have begun to slowly awaken, and by talking and being an advocate for nature as the therapist. I think that's really important. And the more we spread that out, like the wood wide web, we just keep growing our roots, connecting to each other. That's where we're going to make a difference. And like I say, this work just doesn't happen overnight, because nature does not hurry. Still, everything is accomplished. We'll talk more about influencing policies because there's a lot of work around policy that we do at an institutional level. But policies should always keep community in mind. That's really important. It's not about how important am I. It's you have to think about the community because it's only community and the ongoing relationship to the generations that continue the work that's important. So you have to keep community in mind. We've heard so much about the importance of community, and that's really important in the work that we do in forest therapy. So here's the call to action. Do you agree that we are at crossroads these days with nature and how we connect to nature and protecting our nature? We need to protect the forests, and they will protect us. And on my closing reflection, I want you to imagine a future where community, urban or rural, has access to a curative and healing forest. Wherever you live, you can say, I want to go on a forest therapy walk. I want to find a guide and spend my Saturday or Sunday morning in nature with my community. I don't need to know what I'm going to do. The guide is going to guide me. The guide is going to support me. The guide is going to hold space for me. And I will feel safe, and I know I'll feel good. So these are the questions, and Joey is going to hand out a sheet of paper for you to think about over the next few days. You can take it home, you can write, you can discuss it with your friends, your family, your community. But these are the questions. What would change in your community if forests are treated as essential health infrastructure? Now, a forest doesn't have to be a place where you spend hours to get to. It could be a botanic gardens. It could be a nature reserve in your neighborhood, but a place where you feel safe to go into nature. And without having to take a car ride of 6 hours. It should be within a couple of kilometers from your home. How can you personally contribute to protecting or restoring a local forest ecosystem? So we each play a part at an individual level. And what partnerships across health, tourism, education, or government can help build a forest therapy model where you live? And in this respect, here are our details. This is the name of our organization, the International Nature and Forest Therapy Alliance. You can contact us if you have an idea, you want to know, look, I've got an amazing space, Susan. Can you help us? What do I need to do to call this, to certify this as a forest therapy center or a forest therapy trail? We are a not-for-profit organization. We will soon be getting charity status and hopefully attract more money, more finances, more co-funding so that we can, and there are a lot of people out there who are really worried about the future. They want to leave this planet a place that their children and grandchildren can live and work and thrive. And they're like, where would I give my money? To the next football team? No. Give it to us because we are accountable. We are a charity. Believe me, it's hard work to become a charity and to stay a charity. The government and the taxation office in particular is very interested in what you're doing. But that's my bit. Thank you. I was on time. Good.